Welcome to Lecto. Today we are going to discuss beta-thalassemia. Beta-thalassemia is basically a genetic disorder in which you will see the reduction in the beta globin chain of the hemoglobin. As we know that the hemoglobin consists of 4 chain, 2 alpha and 2 beta. If the reduction in the beta chain occur, then it is called the beta-thalassemia. So first of all, in this lecture we will discuss the basic types of the hemoglobin, then its genetic composition, and last we will discuss the classification of the beta thalassemia. Let's start. So first of all, we will discuss the types of the hemoglobin. What type of hemoglobin present in the fetus and what type of hemoglobin present in the adult. So here you can see we are going to discuss normal hemoglobin, fetus and the adult. Normally, the major hemoglobin which is present in the fetus is the HbF. HbF is the hemoglobin which is present in the fetus and it has 2 alpha and 2 gamma globin chain. Next, if we talk about the adult hemoglobin, then it has HbA, HbA2 and HbF. Again, HbF present in both fetus and the adult. HbA has 2 alpha and 2 beta globin chain. A2 has 2 alpha and 2 delta globin chain. And last, HbF 2 alpha and 2 gamma globin chain are present in the HbF. So these are basically the normal hemoglobin. If we see the genetic composition, then you can see that you see the 2 chromosomes. This chromosome number 16 and chromosome number 11. These are basically the homologous chromosome. At the chromosome number 16, you see the alpha globin cluster and it includes alpha 1 and alpha 2. These are the 2 genes for the alpha globin, and you also see the zeta gene which is involved in the formation of the zeta globin chain. Next, if we see the chromosome number 11, we see beta globin cluster is present on the chromosome number 11, and you see different genes like first is the you see the epsilon G, next is the gamma, and third one is the delta, and last one is the beta. So these are basically the different genes which form the beta globin cluster, and these genes are present on the chromosome number 11. So these are basically the general compositions of the genes or arrangement of the genes on the different chromosomes which are actually involved in the formation of the different globin chain of the hemoglobin. Now we will discuss the beta globin composition graphically. So first of all, you see that we take the allele on the x-axis and alpha and beta percentage or the amount of the alpha and beta globin chain on the y-axis. So keep remember that we are going to discuss beta defect. So in this case, alpha gene and the alpha globin chain will remain the same, but you see only defect in the beta. So here you can see that actually 4 alpha alleles are involved in the formation of the alpha gene. So in this case, all the 4 alpha allele form the proper quantity of the alpha globin chain, and there will be no defect in the alpha. But you see only defect in beta. Here you can see 2 alleles are involved in the formation of the beta globin chain. Here you can see this is actually the beta, this case, and you see 2 alleles, one present on one homologous chromosome. Each homologous chromosome has 1 allele. So basically 2 alleles are involved in the formation of the beta globin chain. Before we start, you should know the basic difference between the beta positive and the beta node, because these terminologies are quite difficult. So first of all, we will discuss the beta positive and beta negative. Beta positive means that if there is reduction in the function of the gene, then it is called beta positive. Reduction in the functionality of the beta gene, then it is called beta positive. And if there is an absence of the beta gene, then we call it beta node. So first case, we discuss the first case. In first case, both the beta allele are normal, and we see that the beta globin chain amount will be proper. So here you see the proper amount of the beta globin chain. Next we will see that if one allele is beta positive and second is beta normal beta, then we see there is a reduction in the quantity of the beta globin. Next, again further, if one allele is completely absent but other is present, which is normal, then further reduction in the quantity of the beta globin. So there is a basically difference between beta positive and beta node. Beta positive produce small amount of beta globin chain, but beta node cannot produce any amount of the beta globin chain. So this is the basic difference between beta positive and the beta node. Next case is the beta positive and beta positive. In this case, both the globin chain, beta globin chains are reduced in quantity. So in this case, further reduction in the beta globin chain you can see on the graph. Next we will discuss when there is both the alleles are beta node and beta node. In this case, there will be no beta globin chain. So in that situation, you will see only alpha and there will be no beta globin chain. So first case is actually, this first case is normal. This is the normal case and there is no defect. Second and the third is called thalassemia minor. This is the minor case. And second last is the intermedia and last is the major. So thalassemia major. So these are basically the thalassemia minor, intermedia and major. Now we will discuss in detail these three types: minor, intermedia and major. So first of all, you see that we categorize beta thalassemia into thalassemia minor. This is the thalassemia minor, or we can also say that it is the trade state. It is mostly asymptomatic. Next we will discuss thalassemia intermedia, and it is also called non-transfusion thalassemia. In this case, you do not need any transfusion of the blood, but in some, if the severity is increased, then you can also need the transfusion of the blood. And last is the thalassemia major, or you can say transfusion thalassemia, in which you need to transfuse blood. So first of all, we will discuss the thalassemia minor. Genetically, two categories falls in the thalassemia minor, or you can say trade. So first category is the, you see, beta positive and beta. Second is the beta node and the beta. These two categories fall in the thalassemia minor, or you can say trade. You can see that the one allele, in both the case, one allele is completely absent or reduced in function. It means that the amount of the beta will reduce in this case. Next, if the beta is reduced, then what will happen? We revise again the hemoglobin. So first of all, you see that the hemoglobin F, hemoglobin A, hemoglobin A2. These are basically the three hemoglobin, And the composition, hemoglobin F has 2 alpha and 2 gamma, A has 2 alpha and 2 beta, and A2 has 2 alpha and 2 delta. So now what will happen? If the beta globin chain is reduced, if the beta globin chain is reduced, then the quantity of the alpha will increase, automatically increase. If there is two quantities and both are equal, if I reduce one thing, then automatically the other will increase. We can consider other is increased. So in that case, you will see if the beta globin chain is reduced, then the alpha will increase. Then this alpha has two options. It can bind with the gamma and it can also bind with the delta. So it has two options. It can bind with the gamma and delta. So in this case, we will see that there will be increase in the quantity of the HbF hemoglobin and HbA2. If the alpha combined with the gamma, then the quantity of the HbF hemoglobin will increase. If the alpha combined with the delta, then the quantity of the HbA2 increase. And in this case, you will see that the HbA will reduce. This will reduce and these two hemoglobin will increase. So in thalassemia minor, you see that the HbF and the HbA2 will increase. And also you see in thalassemia minor, microcytic hypochromic anemia. So you see in the microcytic and hypochromic anemia in the thalassemia minor. Next we will move towards the thalassemia intermedia, or you can say non-transfusion thalassemia. We categorize into 5 categories. First one is we discussed homozygous condition. Homozygous condition. And in this case, homozygous condition will be beta positive and beta positive. This is the homozygous condition of the thalassemia intermedia. In this case, again, we will see that the beta globin will reduce. Quantity of the beta will reduce. So what will happen? That we discuss that the alpha 2 gamma, alpha 2 beta 2, alpha 2 and delta 2. This is the hemoglobin F, this is the hemoglobin A, this is the hemoglobin A2. If the quantity of beta is reduced, then this alpha, if before birth, this alpha will combine to this, because A2 will reduce for afterward, then there is a more chances that the alpha 2 will combine with the gamma. So in this case, you will see the increase in the quantity of the hemoglobin F. In homozygous condition of thalassemia intermedia, you will see the increase in the quantity of the hemoglobin F. And there is some chances that the hemoglobin A2 can also increase, but the majority increment will be in the hemoglobin F. So this is the case of homozygous condition. And in this case, you see that normally if we see the ratio between the alpha and the beta globin chain, you see like there is equal amount of the alpha and beta globin in the normal condition. But if we see the homozygous condition in which beta positive, in which the beta quantity is reduced. Let's suppose the quantity will reduce to 50% of the beta and the alpha will remain the same. Automatically, as we discussed previously, then the quantity of alpha will increase. So now we will see the difference. The basic difference between 80 and the 50 will be 30%. This is the case only when you see the homozygous condition. If there is a thalassemia coexist with the beta thalassemia, if both the thalassemia alpha and beta thalassemia exist in one person, then what will happen? You see that this is the case when only the beta thalassemia exists. But along with the beta thalassemia, if there is an alpha thalassemia, then you see this is the 50%, and if the alpha thalassemia exists, then it will let's say reduce to 60%. Alpha chain will reduce to 60%. Then what is the difference between these two globin chain? Then it will be 10%. So this is the co-condition when both the alpha and the beta thalassemia coexist in one individual. If both the exist, then the severity of the difference between the alpha and the beta will reduce, which will be 10%. But if only beta exists, then the difference will be 30%. So this is the case in some situation along with the beta thalassemia. If the alpha thalassemia exists, then it is more favorable condition rather only beta thalassemia. So this is the case of homozygous condition. Next we will see the heterozygous condition. Heterozygous condition. Hetero means different. It means we are going to discuss two types of beta positive and beta not and beta. This is actually similar to the twin, but now it is different. How? We categorize into two heterozygous. First one is the excess alpha globin chain, and second one is the dominant beta. So these are basically the two conditions. We revise it, ratio between the alpha and the beta, 80% and 80%. This is the normal composition or the balance of the alpha and the beta globin chain in a hemoglobin. But if we see this condition, beta positive or you can say beta not, then what will happen? Let's say its quantity reduced to 50% and alpha will remain the same. So basic difference, you see the difference will be 30%. So this is the case when this trade condition exists. Then why it is different from the previous one? It is different because alpha globin chain will exceed, the quantity of the alpha globin chain will exceed, let's say previously it was 80%, but now it become the 100% and beta will 50%. Then now the difference will be 50%. In that situation, the difference will be 50%. This is more severe and this is less severe. If only this condition exists, then we categorize into the minor. But if excess alpha express, then we categorize into the intermedia. Although it is similar, its genetic is similar to the previous minor case, but on the basis of the excessive imbalance between the alpha and the beta, we categorize it into the intermedia. So this is the case why we categorize this type of genetic basis into the intermedia. Next, dominant case. Here let's say this is the two allele, it can be positive and not. Then if we see the dominant cases, then what will happen? Let's say we talk about the color of the skin. Let's say capital C and small c. These are basically the two alleles. If the capital A is dominant, then even though small a is present, but its function is reduced, only the major function will be the capital, which is dominant. So in this case, if the beta positive and the beta not is dominant, then only the function of these two allele will be expressed. So in this case, there is severe or highly reduction in the beta globin chain. Here you can see, if we see, these are basically the two cases of the minor. But if there is a highly reduction in the beta globin chain, we categorize into the intermedia. because in this case beta positive and the beta node are dominant cases. If they become dominant, then the beta globin chain will highly reduce and we categorize into the thalassemia intermedia. So this is the case why we categorize dominant beta thalassemia into the intermedia. So these are basically the two cases, excess alpha and the dominant beta. Next move forward, that third is the delta and the beta thalassemia. So this is the case, delta and the beta thalassemia. In this case, delta and the beta will reduce. How? So first case, if we discuss that the homozygous condition, homozygous condition. So we categorize homozygous condition into the beta positive and beta positive. These are basically the same. We categorize it into homozygous. In beta positive, the beta globin is normally reduced relative to the thalassemia minor. In this case, you will see that the beta globin chain will be reduced. Then what will happen? Same case like this one. If the beta is reduced, then what will happen? Then alpha quantity is increased. Then alpha start combining with the gamma. So in this case, when alpha combine with the gamma, and HbF quantity will increase, highly increase. The major portion, 99%, you see 99% HbF hemoglobin in homozygous condition. So next, if we see heterozygous condition, then what will happen? In heterozygous condition, we categorize two things. First is the beta positive and beta. Next is the beta node and beta. So this is the heterozygous condition. In that case, again, beta is reduced. Beta will reduce. And in that case, some quantity of beta produced. Even though it is reduced, then some quantity is exists. In that case, you will see that the alpha combined with the gamma and it will form the HbF. So this is the, in both the case, but in this case HbF will be 20%. 20% HbF hemoglobin in the heterozygous condition. So do you see that this condition, heterozygous condition, is similar to that or similar to that? No. These two condition, this condition is different from like trade. How? In this case, you also see reduction in the delta. I am talking about delta and the beta thalassemia. In this case, in fourth categories, you also see in the reduction in the beta and the delta. In both the case, you will see HbF and you do not see HbA2 because in this case, delta is also reduced. So this is the special case in which the beta as well as the delta will reduce. If both the reduce, then it affect the both. First one, it will affect the HbA because in it you see the beta globin chain. If the beta is reduced, then the HbA is reduced. If the delta is reduced, then HbA2 is also reduced. So in this case, you only see the HbF, homozygous condition and heterozygous condition. But the quantity vary. In homozygous condition, you see 99.9% HbF. But in heterozygous condition, you see like 20% HbF. So these are basically the homo and heterozygous condition. So if you differentiate between the different things, then it will be easier for you to remember different things. And last one is the homozygous HB hemoglobin lipore. So this is the homozygous condition. This is the special case, and in this case you will see homozygous condition, beta positive and beta positive. This is the case, and you also discuss along with the beta delta. So this is the, you also see the beta condition and the delta condition. If we revise the genes of the beta and the delta, you see beta and the delta genes are close each other. So in this case, if the crossing over happens between the homologous chromosome, then the beta and the delta genes exchange their segments, and when they exchange their segment, then what will happen? Let's say you can see that here, this is the case. This portion is the beta gene. This is the beta gene, and this is the delta gene. This is the delta gene. And when the transcription and the translation occur, then it will result in the combined structure. You see that this is the beta globin and this is the delta globin. This is beta and this is delta. So in this case, both the beta and delta globin combine and form a single one. So it is actually defective. In this case, at the side of the delta, you will see NH2, and at the side of beta, you will see COOH, because globin are composed of many amino acid. So amino acid has NH2 and this COH at their end. So this is at the delta side, you will see the NH2, and at the beta side you will see the COOH. So in this case, this is actually defective case, and it result in the homo-HB lipod case, in which both the beta and the delta combine, and it result in the HB lipod case. And in this case, you will see like different MCH and the MCB low in this case, homo HB lipod condition. And next we will discuss persistence hereditary HbF. Persistence hereditary HbF case. In this case, we see that the defect will be in the delta and the beta. Both the genes will be defective or deleted. And the defect can also be in the BCLA11. This is the gene or the transcriptional factor which is involved in the conversion of the gamma to beta. So, if the defect happens in the delta and the beta, then what will happen? Like you see, beta will reduce, HbA reduce, and delta will also reduce. HbA and HbA2 will reduce, but you only see the HbF will be prominent or high in the case of persistent hereditary HbF, and you see only HbF hemoglobin, because it has 2 alpha and 2 gamma. In both the case, you see the HbF which has alpha 2 and gamma 2, and these two genes are normal and produce the normal globin, but there is a defect in the delta and the beta. So in this case, you will never see the HbA and HbA2. And last is the associated disorders which coexist with the alpha. 3 cases can coexist with the alpha. First one is the HbE hemoglobin, HbS hemoglobin, and HbD hemoglobin. So these are basically the 3 hemoglobin which can coexist with the alpha, and if they coexist, we categorize into the intermedia. So first of all, we will discuss the hemoglobin E. In the beta chain, glutamic acid will convert or replaced by the lysine. If the HbE coexists with the Beta-Thalassaemia, then in this case you need to transfuse blood. This is the case in which you have to transfuse blood. Otherwise, this is intermediate is non-transfusion case. But if this condition coexists with this one, then we have to transfuse blood in this case. Next, if we talk about the HBS, which is the sickle cell disease. In this case, glutamic acid will replace by the valine. Glutamic acid replaced by the valine. Then what will happen? In this case, you majority see the symptoms of this sickle cell disease, but it exists with the beta-thalassemia. Next is the HBD. In this case, glutamic acid is replaced by the glutamine, which is actually the precursor of the glutamic acid. In this case, this is actually common in the Punjab, which province Punjab, and this coexists with the beta-thalassemia, so we categorize into the intermedia. So these are basically the HBE, HBS and HBD. These are abnormal. Keep remember, these are abnormal hemoglobin and they coexist with the beta. Last is the thalassemia major. In this case, what type of genetic composition you will see? Beta naught and beta naught, in which there is no beta globin. There is no beta globin. So in this case, the beta globin you will never see. Then what will happen? It's mean the quantity of the alpha is highly increased, even though it combined with the delta or it combined with the gamma, but it exists in high quantity. Then what will happen? Here you can see this is the red blood cell, and in this case, if the lot of alpha globin exists in the RBCs, then our bodies, specifically spleen detect these abnormal RBCs which has lot of alpha globin, and this spleen actually split or hemolyze these RBCs. So if there are a lot of RBCs and all the RBCs having alpha globin, then lot of hemolysis occur in our body by the spleen. So in this case, you will see a lot of symptoms of the hemolysis. So in this case, in that situation, we have to splenectomy. We have to do splenectomy or remove the spleen, because spleen continuously break down the RBCs and it is more severe condition and sometimes it causes death. So in that case, we do splenectomy. It will help in the prevention of the severe condition of the hemolysis. And along with that, in the case of accumulation of the alpha globin in the RBCs, ineffective erythropoiesis at the breakdown at the bone marrow can also exist. If we do splenectomy, then what will happen? We can see at the periphery hypochromic, because globin is not produced properly. And main important thing which is present in the splenectomy, if we do splenectomy, then you see Howell Jolly bodies. This is the case. Howell Jolly bodies. What is Howell Jolly body? This is the RBCs, and if there are several DNA remnants present, then it is called Howell Jolly body. Howell Jolly bodies are basically the remnants of the genetic material which are present in the RBCs. Normally, if these Howell body present in the RBCs, then our spleen normally remove these or hemolyze these RBCs. But in that situation, we remove the spleen, and if there is no spleen, then lot of Howell Jolly bodies RBCs will wander in the whole blood. So this is the case which is highly specific or related to the splenectomy, in which you mostly see the Howell Jolly body in the RBCs. So this is all about the classification of the beta thalassemia. If you have any question, then you may ask in the comment section. Thank you.